Good morning, good afternoon, good evening, depending on where you are watching us from. We welcome you on Matters of Life. We are here to discuss matters of life. And today we are blessed to have our two deaconesses who are occupational health practitioners. And before, I'm Mary Linda Tedeku, who is your host for today. Before we go on, I will allow my guests to introduce themselves on what they do on their field before we start with the questions. So, first of all, we have our deaconess, Rita Bwedi Ayaba here, and then we have our deaconess, Mary Otu, also here. So, first of all, I'll allow our deaconess, Rita, to tell us what you do as occupational health practitioner.
Hi everybody. So as Mommy said, my name is Rita Bwedi Ayaba. I'm occupational health advisor. I've got a nursing background. With occupational health, you could be in any health sector, whether physio or nurse or a doctor or a counselor. So my background is a nurse. So with that, we advise on health matters pertaining to work. And that also involves anything that is at risk. When you, with work, you could be exposed to so many health or health hazards or risk. And as occupational health, we look into that and see how we can mitigate that. And that's most of what we do with my role particularly. And as a nurse, because I've got that health background, when people come to me with health issues, we're able to advise. So my role is mainly advising and also signposting to any and everything, probably like to the GP, to a physio, to a counselor, or just even advising on how to take care of yourself properly and balancing work and personal life. So it could be anything and everything, but we focus more on health issues that relates to work. Thank you.
Thank you so much. We'll go to our Mama Mary, Deaconess Mary also.
Hello everyone, my name is Mary Otu. I think Rita said almost all of them. My job role is an occupational health practitioner stroke advisor. And I think she said most of the things, but usually because I work basically in the hospital, so I'm in the middle of the hospital. Everybody can come in and everybody can come out. We get people who will come in crying for advice. Some people need a bit of counseling. Most of the time I deal with managerial referral as well. So trying to get people back from being off sick for a while, try to get them back. So for them to come back, that means you have to put some kind of adjustment and recommendation in place for them to come back. And that's one thing that we do as well. And on my typical day, I do something that we call the pre-employment as well. So with pre-employment, before somebody comes to work, they would have probably declared a health condition. So this health condition could be diabetes, it could be hypertension, it could be stroke, it could even be cancer. These our employees are going through quite a lot. So if somebody has declared something on the application form, we can't let them work or give them work or make them start working until we've gone through this employment with them to see whether we can put adjustment and recommendation in place for them before they can start. So apart from that, everything that Rita has said is something that I do, but this is just a top up of,
All right, okay, so before I go on my next question, I want to ask, so does every company has an occupational health?
Every company have to have
supposed to.
They're supposed to.
Because people are going to go off sick, people are going to be poorly, and obviously occupational health will look after the staff members, the employees. So if you are an employer and you don't have an occupational health, then by law, you're not doing something right. Because you're definitely going to have people go off sick all the time. And some people are going to go for ages, so we need to try and get them back. So every company have to have one.
Thank you so much, Yeah, and so I'll go to my. I think you've answered the first question, which I was going to. What is occupational
Yeah, I was
health?
trying to
Which
refrain from that.
yes, yes. So I think you answered
So
that.
I was quite broad at the beginning so that we can get into
Right.
But
Yeah.
okay
So
then, yeah.
I'll go to my next question because you've said a lot about that
Yes.
already. Okay. So the next question is, what is the common health risks associated with our specific workplace environment?
All right. So we with occupational health, we can it depends on what industry that you are affiliated with. So you could be with the health, you could be with manufacturing or sewage and water, which I'm exposed to. So we work with different industries, and depending on what they have got, we look into their screenings. So it could be eye test, it could be audio test. So there's so many, and with health sector, there is I don't know, most people should know that it's quite demanding and draining. So the risk mainly it's to do with stress. Stress, being overworked and struggling to manage your life and also work. So that's one of the risks that we look into. We look at with health sector as well. We look at exposures that you could be, diseases and viruses that you could be exposed to, that we need to make sure that you are covered. So that's one of the risks that we look at. Do you want to add a bit more? Then I can just
obviously, because I'm in the hospital setting as well. Normally we got something that we call the manual handling, so it's very important, whereby obviously people have to have training for it. So if you're not using the right kind of technique, that means that's how people end up with back pains and all of that, because obviously you're not using the right technique. So training is normally very important. So when an employee start work, we need to make sure that we do this manual handling with them. We give them a training for it, and obviously we got a display screen assessment as well. So like I was talking about pre-employment, somebody have said something about having a back pain, you need to make sure that you do this display screen assessment. So you need to make sure they got adjustable chair, adjustable table. You need to make sure that everything is right for them. I think, and the other thing is PPE. Obviously, I work in a hospital setting, so PPE is something that when COVID, obviously, since COVID has come out, it's become very important. It wasn't something that we used to do that apart from the gloves. So that is very important. We need to know when we're using this, our PPE or personal protective equipment, which is normally our mask, putting on our gloves, putting on our gown. So when people are not doing it, then you're prone to infection. That means that obviously you're going to end up with things, and people go off sick because they didn't use the right PPE.
So I know you train, as you have said, before the person start work, you have to make sure the person is trained.
Actually, Mommy, what we tend to do, I don't know, probably we work slightly different, but what we tend to do is signpost or prompting the manager and also the individual candidates that you need to get this and that in place before you start work. So for my sector, we do not get involved with the the actual training but we prompt them to say you need to get this done so that this person or this candidate will be able to work effectively and safely. So we don't really do the actual training or we signpost and we advise
for them to do it
that this is what is needed.
Thank you so much. Thank you so much for that. And so the third question is how can we improve workplace safety and prevent occupational injuries? How can we improve workplace safety and prevent occupational injuries?
Training is very important. So we start off with training, just like any other job, any job that you start anyway, you're supposed to have training. If you don't have training, you're not going to be able to use that bed. You won't be able to use this. You won't be able to use that. So training is very important. And at my workplace, we got something that we call the huddle. So it's whereby we have meetings every kind of Monday to talk about what has gone right and what has gone wrong. So if any department can do that, then they will know what has been going wrong and what has been going right. So it's very, very important to have that, even if it's just like once a day, once a week, you have that training. Somebody will say, oh, the other time this happened, the other time that happened. So by that happening, you know, you're making sure that it doesn't happen again. We look for a solution to it, kind of thing. So reporting is very, very important as well. You have to report if anything happened at the workplace. Let's say you've had a needle stick injury, you've pricked a patient and then it's pricked you back, or splash, we call something splash contamination, whereby sometimes urine can even go into people's faces, people spit on people bite people. So all this, when it happens, you get some of the workers that will not report it, and they will wait for ages before. And if this person has got some kind of viral bloodborne disease, you know, you will prone to be having it. So you are not HIV positive or Hep B, and then all of a sudden, because you had an incident, you didn't report it, you know, you get it. But whereby you've reported it to us, we will make sure we give you the right kind of treatment as well. So reporting is very, very, very important. It's something that we always stress, you know, with the employees and the managers. If there is anything, you know, you have to report and take it serious as well. Do you know what you're going to say?
In addition to what Mary said, also communicating. You might have started, like from our background or individuals that we speak to with our mothers and fathers. You might not know exactly what the health or the risk or the policies, you know, all the stuff that is needed for you to be safely working in your environment. So communicating to the right individuals. You might have all the paperwork available to you, but you may not be able to, there might be a language barrier. You might know the English, but maybe certain words you do not understand. So those barriers are also a hindrance to some of our community mummies and daddies. And it's very important that you speak to your fellow colleague or your senior member, to speak to them about, okay, what does this mean? What am I supposed to? So apart from the training and also reporting, you need to also communicate with your colleagues and also with your seniors to find out, even at home, your family members, those that are more literate, can even help with, okay, what am I supposed to know in order to work safely? So and having that confidence to speak to as occupational health, that if you are having any barriers or lacking understanding, speak to us. And that's where we've got an advisory line where we speak to individuals about any and everything that you've got query about, and we are available to answer your questions.
Good. I think you said something about language barrier. And I believe in every company or in every organization, they have an interpreter, somebody who can translate if you can't speak the English. That can. So you have to go and speak to somebody, even if you cannot speak the English, and then they will find somebody to interpret.
Sometimes we even have to postpone an appointment if there is no interpreter available, and then when an interpreter comes, that we can.
For our settings, we are more accommodating if probably you bring a family member or any individual that can help you with these barriers. So it could be anything. It doesn't necessarily have to be a professional when it comes to individual workers and what they need.
Good. That is great. Very understandable. Okay, so let me go to my next question because of our time. What protocols are in place for handling workplace accidents or emergencies? What protocols are in place for handling workplace accidents and emergencies? What protocol? Do you have any protocols?
We got some. We got a bloodborne. So contamination splash. So especially with ours, because my one is a hospital setting, you get to have a lot of people coming in with needle stick and blood contamination splash. So we have got that policies available for if anybody have any kind of needle stick or contamination splash. We got a procedure that we have to obviously follow, and then we got a PP as well, and then we got What's the other one? If you got any other one that you want to
The problem is because we work not just with the health sector. Every industry have got their own policies and protocols in place.
Right.
Our main job is to find out what is the protocol there, so that we can just prompt you that. Tap into that and work safely within that remit. So in terms of protocol, because we are affiliated with the health industry mainly, because every occupational health works with, they work with a health sector first before any other sector. So with that, apart from the PPE, the contamination reporting, there's also the health and safety executive protocols that are in place, like radar. What else is there? There's quite a lot, but noise pollution, manual handling, ergonomics. So it's very
vast. It depends on where you are.
It's quite tricky to pinpoint exactly.
Yeah, but at least every company have a protocol that you have to follow.
Exactly.
So you signpost them to, or you advise them of what to do.
So one of the ones that we get exposed to a lot is the manual handling. Like in terms of if they come presenting with MSK issues, we'll be like, okay, you need to go through the manual handling protocol, making sure that they are not maybe exerting themselves or turning or lifting. Also, we say do according to the manual handling protocol, so that it does not be a hindrance to that individual with contamination injury. That is ours. So it's mainly reporting to us. So if you get any contamination injury or even an accident at work, you need to report to us and also do an incident form, so that if it's whichever if it's whatever department that you had those accidents, it's also those reporting also goes to them, and then that's so it flags it up so that everybody will be aware of what's happening and how we can reduce those things and also help you get better. So it's very
in terms
vast.
of manual handling, I know, especially in the care sector, you know, it's a very big, I know you have to advise them or advise the company to train their, you know, their workers. And so if you have trained, if your company have trained you, and you injured yourself, is it the responsibility?
Yeah, it's still a workplace incident. So if you talk about occupational health, normally it's psychological and musculoskeletal, which is normally our back pain, hip pain, and this pain and that pain. So anything that happens at work, at the moment I'm speaking to 2 people that have had accidents at work and have obviously not reported it. Well, they've reported it, but they've not done anything about it, which they could have done something about it. And after 2 years, that's it. You can't sue the company, you can't do anything. And these people are staying at home, they are not being paid, and they happen at work. And it's only because it's knowledge and the fact that people do not know what to do. So it is very, very, very important that if you have an accident at work, it is accident at work. Even if something hits you, I know somebody that dropped a mug and it went into their leg. Yeah, they might have done that, but it's still accidental. It's still clarified as accident at work, and something needs to be done about it. People are staying at home, not being paid, which is not fair. And most of the time, it's just the fact that people do not know what they have to do. So after 2 years, if you've just stopped working, or obviously because you've not been going to work, they decided that, okay, you should stop working, which in one of their cases, that's what happened. They couldn't work anymore, and they could have sued the company, but obviously because of ignorance, they didn't know. And by the time I got to know about it, it was 2 years after, and you can't do anything about it.
After 2 years, you can't do it.
So even we get a lot of nurses, most nurses have got back pain, haven't they? Yeah, because of the job that we do, you can do the correct, but it's just, because we keep sliding patients all the time, and even when you use the sliding sheet, it's still the same. So you're definitely going to have to, most nurses, if you look at the way we work, it's a different thing altogether. Most of them have got some kind of health condition. It doesn't mean they're not doing the right manual handling. They are, but it just happens. Because if you've got somebody who is
could
very
also be
big,
classified as repetitive strain injury. You're doing something continuously,
Continuously,
so
Okay.
that is it will have a massive impact to your health. Apart from the DSC, the
Right.
desk and ergonomic stuff, which is also repetitive with the mouse and also manual handling. Doing something continuously
Yeah.
will have
Yeah.
a
Side
effect on
effect.
you
Right.
eventually. So it's pacing yourself and.
I want to understand these bits, clearly. So. If you are a carer or you're a nurse, and maybe as you are lifting regularly, like you have a patient, and through that, you started having a back pain. Do you have to report
Yeah.
for the company to take responsibility, to be responsible for that?
Well,
Or
because
I
it's
know
a back pain. If you've not injured with it, in the sense that you have to stay at home because of that,
Right.
and it's just a back pain. Obviously, you
Everybody
can go
has
off
to
sick
have
for a
Direct
bit and
you
then
to
go
the
to,
right
and then we've got
Okay.
physios as well.
All
So
right.
in our department, we've got physios that we can signpost you. So we do
Right.
a lot of signposting to counselors, physios, who obviously do some kind of assessment with you. And apart from our department physios, we've got another physio in the department that actually do more physical one with you as well. So they will take it until you go off sick and you decide not to come back because obviously it's too much, or maybe you need surgery. I know most nurses that have had back surgery because of the job they do as well. So yeah, until maybe, they say, okay, you cannot work because of your back, because, you got back pain and it's not helping. And then it happened at work, then we have to do something about it.
You cannot work at all.
Yeah, that's when
Right.
you cannot work at all.
Okay.
But if you can, we will signpost you to a physio who will go through an assessment and
Right.
do all the other activities with you.
Right. Thank you so much. Because of the time, let me go to my next question, and then maybe so the next question is, what are the legal? Oh no. Let me. Can you provide guidance on managing stress and prompting mental well-being among employers? Can you provide guidance on managing stress and prompting mental well-being among employers?
Always ask.
Always
It's as simple as that. And I think with, sorry to say, with us black people, it's difficult for us to, ask. Stress is one of the most biggest thing in the NHS or even anywhere. I'm sure every employee will have somebody going through stress. And sometimes it's burnout. It could be personal stress and it could be work-related stress. So we've got work-related stress. I know most people that will go home because they've had a problem with their manager, they've had a problem with this person, they've had a problem with that person, and they will say they're not coming back to work until that is resolved. So we've got work-related, and that's probably work-related, and then we've got personal one, whereby maybe at home there is some personal issues that are happening. So yeah, we got that as well. But one thing with stress is you always need somebody to talk to. And one thing with nurses is nurses do not take break. So we are always burnt out. So somebody will have 30 minutes break. They got notes to write. They got this. Some people will tell you, I've not even drank the whole day. I've not passed urine the whole day, which obviously causes stress. So having regular breaks is very, very good. It will release your stress. And if you got somebody that has got a medical condition, normally we'll say, apart from the 30 minutes break that they normally have, they should have 15 more. That's when they've come to occupational health, and we've put in what we call recommendation and adjustments in place for them. We'll say, okay, this person is supposed to have extra 15 minutes because of the health condition that they've 15 minutes, 1-5. So after the 30 minutes, extra break or regular breaks because of the health condition. Like if you got somebody who is like diabetic, or even if for stress, I normally say, let them go off for a bit. Sometimes some people just going for that fresh air helps them. Let them go out for that 15 minutes, clear out their mind and come back, because that workplace there is too much going on. Like I said, we got burnt out and everything. So definitely talk to us. If you come to us and you got stress, we got stress risk assessment that we'll go through with you. If we have to signpost you, we'll signpost you to a counselor who is neither in the department or who will give you a phone call. And we've always got numbers that we give to people beforehand. But the first question that if you've come to us with stress, anxiety, and depression is whether you want to commit suicide. Yeah.
Oh,
So for me, if you come to my
self-harm.
or self-harm, if you come to my office or my department and you're crying, I'll have to leave the next appointment to obviously attend to you at that moment, even though you don't have an appointment. I have to prioritize you because at a moment that you're coming and you know you're crying, you're stressed, so you're this. I don't know when you go out there what you're going to be doing. So we take it very, very important, and we always advise. You know. Sorry, black people, I'm sorry. But with our people, it's so difficult. Even when a lady has had the baby, you get all these blues, whatever. You go through stress and anxiety and everything. It's very, very important for us to seek the help. We can't say that we're strong enough, so I don't need the help. Else, it's terrible. People are out there seeking help. Most of the, I don't want to say white people, but most of these employees, you speak to them and most of them will tell you how many medications they are on it.
Yeah.
I'd rather be on medication done for that mental health to escalate and then kill myself.
Okay.
Because we refuse to accept it. Some people even think it's an abomination and all of that. So it's seeking help is the most important thing, and we can always signpost you.
And I believe we ladies, menopause stress is another thing.
Yeah, menopause
that,
is the worst one.
That we go through as well. So
with us, for managing stress and also mental health, we tend to signpost. So we've got the employee assistant program that's available. They go through anything and everything with you. They provide counseling. Within occupational health, there's also counselors that help you so that you can talk. With our ethnicities, we tend not to talk or even seek support at all. And that's one thing that we encourage each and every individual, that when you are stressed, when you're feeling that there's something is not right within you, on top of prayer, ask for help. Speak to us, ask us for help. We don't necessarily some of us are counselors, but we are not all counselors. So we direct you. This is the right place that you need to go. Maybe go through your GP or through us. With us, sometimes the waiting time is lesser. With EAPs, it's lesser. The employee assistant program with stress, how to manage it is as our sister said, that you take time out. You ask the manager in workplace that the main thing is ask your manager that you are not coping well in your work. So I need occupational health input because probably you're not getting enough from the workplace or with your manager. Or sometimes you're not able to speak to your manager. So you just say, I need so probably the referral stage is not always through, depending on your industry that you're working with, it's not always through your manager. It could be with HR. So you just, don't be frightened. You're not going to lose your job. It's actually illegal for them to discriminate against you because of what you're going through. So you seek help, saying that you need occupational health input. And that's where we start talking to you to find out, what do you need? How can we help you? How can you move forward from this? And then we also suggest probably you might need this or need that. Apart from some people, they know exactly what they need, but others they don't, and that's where we work hand in hand. What do you need? How can we help? Okay, this is the right path that you could go through, and there's so many resources out there, but sometimes we don't want to bombard you with so many resources. So be like, okay, why don't you try this or one or these, two of these, and see whether it will work for you. If it doesn't and you're still struggling, come back to us. So these are the main things. Managing, if you're not managing very well, speak to us and then we direct. Sometimes you can even do it yourself by going through the EAP or even directly to OH and say, I need counselors or I need someone to speak to, and then we direct. But if it gets to the point where you need occupational health, to direct your manager to support you, because sometimes they don't know exactly how to support you. So we are the main, we are the gap where we're like, okay, maybe you need to, like how Mary said that we create we do not create it, but with health and safety executives, they've created a stress risk assessment, and it's quite good to look into what is causing stress at work. And then you talk to your manager, okay, this is what's causing the stress. Okay, how can we, because with every work, we do not know exactly the ins and outs of how the work patterns are or what you do. So talking to your manager it's like we are the goal to be like, okay, this is how you're supposed to do this in order to manage things better. So look into this, maybe do a regular one-to-one, speak to have a meeting with your manager one-to-one. So we prompt the manager to say, you need to be doing this, talking to that person maybe every week, every month, depending on what they think it will be suitable. And we get into all of this and to help support you. And if it's not working, you can do another referral.
Okay.
And,
yeah, so I was going to ask, so let's say if someone is pregnant or maybe you have an injury and your normal job that you're supposed to, maybe you can't do that job again. They need to give you an easier one or something.
Yes.
Maybe if
you come to us,
so the first place the person has to go is the occupational health.
Actually, in my workplace, we prompt you to speak to your manager first.
Right.
If it's not working or communication
I'm
has
asking
broken down,
what is the manager is not
is the problem,
because
then
I've had that.
If the manager is not doing it, come to us straight away.
Okay.
So with occupational health, we deal with the Equality Act 2010, which means that by no means discriminate against any employee. So that pregnancy is part of it. And anybody with any kind of illness, sometimes it can be diabetes, cancer. So some of them, Equality Act applies, and some of them is likely to apply. Pregnancy, when you're pregnant, there are some people that cannot do the kind of job that they're doing. So even if they have to do admin, that's fine. And when the managerial referral comes in, if the manager doesn't do it, we call something that we call self-referral. And with pregnancy, even before it comes to us, the manager should have done a workplace risk assessment, pregnancy risk assessment before it comes. So you know what the employee can do and cannot do. Don't forget, before the pregnancy, this employee was doing everything that they can, and then all of a sudden you're pregnant, there are certain things that they cannot do. So we put things in place. Okay, make sure she's not doing her normal duties, make sure she do something like an admin role for now until that, make sure she get extra break, you know, she's drinking a lot. So we tell manager what to do. If you get a manager that are not listening, you have to just come to us straight away or call us. Like with us, people just walk through, and with Rita, they have to just call you.
All right, okay. Okay, that is great. I mean, I've learned a lot from you know, because I know somebody who have had that experience.
Anytime
before.
they say no, think about occupational health, and most of the time people are scared, thinking, oh, if my manager knows I've got this and that, maybe I'll be sacked. No, you got right. That Equality Act is to make sure manager do not discriminate against you. That means if you got any kind of disability, if you are pregnant, because of your age, they cannot discriminate. Yeah, they cannot discriminate at all against you.
No matter what background you are,
to be able to
or
work.
no matter what disability or health issues you've got, they are encouraging everybody to work. So the law is there to say that do not discriminate against. So that's where we are there to remind the manager and also the actual industry to say that you need to put this in place, because if not, when the litigations come into place, you are going to get banned. So we are.
Can I just say, and this is legal. So the report that we produce for the managers is legal. So if we put recommendation and adjustments in place for the managers to say, give her extra break, give her admin role, don't let her do this, don't let, and the managers do not do it, and something happened to the employee, it can go to court. So it's very legal, and normally that's what I tell them. I know people who have sued hospitals because occupational health practitioners or advisors have told managers things to do, but obviously they've not done it, and the employee have injured himself, and they've gone off.
I want to also add is that most in any industry, what the managers or the whoever that is your senior tends to throw occupational health as a weapon to say, for it to deem like, oh, you should be scared of occupational health. But we are for the staff members. So do not be afraid at all about occupational health. We are for you. So please, whatever issues you've got pertaining to health and also work, communicate with us and let us know what's happening with you and how we can help direct you to the right resources or the right places for you to get the help you need, or even to stay in, because our main focus is that you work, you stay in work and you work healthy and you are in work for longer. So just come to us. That's what and don't be scared at all.
Right.
We are not scary.
Right.
We're actually
Right.
saying,
Right.
what do you really need? You know? And one of the things that we went to a training, and it was with all these big people in terms of health and occupational health, and they were like, oh, the adjustment or whatever that we put in place, it doesn't cost much. Having 5 minutes, 10 minutes, 15 minutes doesn't cost much. Having what else? Having some ergonomics in place doesn't cost. Making sure that there's training in place, making sure that you're not twisting,
Right.
you are not bending,
Yeah.
you're not. Certain things they don't cost so much. So why are we not putting those in place so that it becomes a problem later on, a massive problem that the person cannot even work at all?
Right.
So we are very here for staff members, no matter your background or your health, and that's why even the government and have put in place that you do not necessarily have to declare your health condition before you apply before you get the job. You do not need to declare that because they don't want you to be discriminated against that. So please come to us. Yeah.
And can I just chip in? Like,
and it's not just nurses, it's doctors,
Everyone.
counselors,
Okay. Right.
all
Yeah,
those
they
service, all those individuals are there to support you. Sorry, Mary.
Okay.
no, it's all right. So if you've come to us and we've made a recommendation, for instance, because of your back, you need adjustable chair or table, and manager tend to say, oh, I'm not pretty. Sometimes they won't tell you because of the cost. That's why. But we've got access to work.
Right.
So access to work is a company that is there. They actually chip in. They fund the chair. They fund the table. So they help the managers. And it's something that people do not know. And I think most managers do not know anyway, because it's just a little form that you just have to fill in.
Right.
If you cannot produce that chair or desk or table for the individual, access to work can actually found that or help you found it.
Recently, there's also mental health.
Yeah. So
there's
all
also
common,
mental health because access to work is more physical health. And there is also another mental health side as well where you get support.
Right.
Yeah, so
interesting.
so many resources.
I mean, it's very interesting. I mean, we've learned a lot, and I think sometimes we intend to, be afraid of, instead of coming to you.
It's because they waive it. Occupational, thinking that
we are
you're
always
going to
for
be
the employees.
for not
we are always.
And sometimes you think you are going to report your manager and you're going to get into trouble, but
and most of the time we rephrase some of the words. So somebody will just, be very emotional, tell you everything that is happening. Obviously, if you say that to the manager, it's not going to look right with the person, or they might even get, their relationship will be strained. So you reframe the words that they've said it. In our report, with our department, I'll put it whatever they've said. But when it's going to the manager, I'll reframe it and do it how the employee wants, so it doesn't strain. But then we've got it for our records that this is what has between them.
Perfect. Yeah, that's interesting. We thank God. I think we have a lot of questions. My next question was going to be, but our time is fast spent. How do you support people coming back to work with people who have had injury or sick and coming to work? So with your 1 minute, going to tell us anything you want to tell us. Maybe you can summarize that as well,
so,
and you can anything that we have not asked or you want to
so in terms of coming back to work, we put in place like phase return. So that means that you work at a percentage of at a percentage
hours
where
or something.
That is not fully your contractual hours, but then you'll be paid your
Fully.
contractual hours.
Oh,
Yes.
wow.
So that's one of the things that we put in place. It could be, so depending on, and we also look at the policy to make sure that we are not overdoing it, because we need to manage expectations. So the policy maybe will say that, if they've got long-term sickness over 28 days, then probably they can have maybe a month of phase return. So it would be like, you can have 50% for the first 2 weeks and maybe 75% for the second 2 weeks. And then if your health condition is that, you still may struggle when you come back, we'll be like, maybe it needs to be reviewed every week to see whether are you coping or not. So it's more of building your stamina back to work. So it doesn't matter what what you went away with.
Okay.
When you come back to work, we will look into, okay, maybe there should be certain things, maybe short breaks, which is very odd, like we say comfort breaks. So it could be, and we also manage expectations. Sometimes people will come in and they know exactly what they want, but we're like, okay, it's not realistic. The job cannot actually provide that. So we need to look at other ways to, especially if maybe your job, it's a 9 to 5, and that is, and you want to do maybe
3 hours or something.
yeah, it's not realistic. So probably maybe an hour to come in, an hour later, or maybe so that is realistic. Or maybe your work is predominantly night and you want to do days, or vice versa. We'll be like, okay, it's not realistic. So we manage expectation. Apart from putting in all these adjustments, and we also manage expectations. Say, okay, this is not realistic. We need to be realistic so that we can make sure that it's operationally feasible within those. So yeah. That's
Thank you. I think she has answered the question.
If
you have anything, anything, or if you want to add something, we've got about 9 seconds.
At the end of the day, we just want you to come back to work comfortably, healthy, working. So that means even if you have to do an admin job rather than your job, so that you get used to it, and that's fine. So yeah, we just want you to, so as much as we can, and sometimes we can even ask you, what kind of support do you need when you come back? And then you tell us, and then we'll put in place for you. So we are that flexible. But
sometimes
we just want you back
clinical,
healthy.
but then because of your health condition, you cannot do clinical. So be like, okay, you have to do administrative. We can also suggest redeployment where you go to a different sector altogether. So
and then when you get better, you come back.
It's individualistic
and speaking to you, to find out, because if you do not know, you just go back to your old your old clinical job where you are suffering.
Yeah, people back and struggle.
And that's what our community does.
That's it.
So
I believe we have learned a lot today. If you are a worker, I mean, you have learned a lot today by going to talk to your occupational health in any distress
it's
or
very
any
confidential too.
Very
very
confidential.
confidential.
That's great.
Unless you tell us to tell the manager, it's very confidential. But if you are at risk to yourself and others, obviously we have to break that confidentiality. But we are very confidential in terms of you telling us what's happening and how we can support you.
We have learned a lot. I believe we have a lot of questions. Maybe you might have to come back again because there are a few questions. But we want to thank you. Take this opportunity to say a big thank you. I know you both are coming from far. You are coming from Coventry, and then Bristol, which is a bit far, coming from church. I just want to take this opportunity to say a big thank you for honoring our invitation, and we have learned a lot. Beloved, I believe if you are a worker, you have learned a lot tonight. Don't be afraid. I mean, if you are going through any stress, any discomfort, talk to your occupational health practitioner. They are there, as we have heard, they are there to help us, not to scare us. So if you have any question that we have not answered, you can drop a question in the comment section, and maybe we'll do our best to ask our mummies to answer those questions for us. We want to thank all of you for watching tonight's program, and this is how far we can come. We want to bring our program to an end. Again, my name is Mary Linda Tediku, and I'm your host for tonight. I want to thank my media team. They are doing very great job. They are a lot here, and I want to thank all of them for a wonderful job they are doing. God bless you all. We see you again in our next episode. God bless you.